Hey everyone, and welcome back to the Deep Dive. Today we are diving into some content from CNUR 202.
202.
That's right, it's a nursing pharmacology course, and we are going to be focusing on medications for cardiovascular health.
Very exciting.
Now, before you go thinking, ooh, pharmacology, trust me, this stuff is way more interesting than it sounds.
Oh, yeah, for sure.
So, to kick things off, let's imagine our blood vessels are like a super highway system.
Okay, I like it.
And cholesterol is like the traffic.
Okay.
Now, too much of the wrong kind of cholesterol can cause like a major backup, right?
Exactly.
Increasing the risk of heart problems.
It's all about maintaining that smooth flow.
Smooth flow, yeah.
Now, when we talk about cholesterol, it's important to distinguish between triglycerides and cholesterol itself.
Oh, okay, so there are like two types.
Yeah, so triglycerides, they're our main source of stored energy from food.
Okay.
While cholesterol plays a vital role in building cells and producing hormones.
Gotcha. So both are essential.
Yeah.
But like with most things, moderation is key. Too much of either can spell trouble.
Right, and that's where those lipoproteins come in.
Lipoproteins.
They act like tiny delivery trucks, transporting cholesterol and triglycerides throughout the bloodstream.
So they're like the 18-wheelers of the cardiovascular system?
You could say that.
All right, so we've got our triglycerides, we've got our cholesterol.
Yes.
We've got these little delivery trucks, the lipoproteins.
Uh-huh.
How do we keep all of this in check?
That is the question.
I'm assuming medications are the magic bullet here.
Well, not quite.
Not quite. Okay.
While medications can be incredibly effective, they're actually considered an adjunct to lifestyle changes.
Oh, really?
Yeah, it's like trying to fix a leaky roof.
Yeah.
You can patch it up,
Right.
but if you don't address the underlying structural issues, the problem will keep coming back.
Okay, so the medications are like the patch.
Yes.
But we've got to fix the structure of the roof, too.
Precisely.
Which is our lifestyle,
Exactly.
diet, exercise, all that good stuff.
Uh-huh. And several factors actually come into play when deciding whether to start medication.
Okay, what kind of factors?
So we look at your lipid profile,
Lipid profile.
which basically tells us your good and bad cholesterol levels.
Okay.
We also consider your overall risk for a heart attack or stroke, family history, and you know how well you're managing those all-important lifestyle changes.
So it's not just a one-size-fits-all approach.
Not at all. It's very individualized.
Okay, so let's say lifestyle changes alone aren't cutting it. What kind of medications are we talking about here?
So there are several different types, each with its own unique way of tackling high cholesterol, but we'll focus on the most common ones. Statins, bile acid sequestrants, and fibrates.
Statins, those are the big guns, right?
They are indeed one of the most widely prescribed medications for high cholesterol.
And for good reason, I'm assuming.
And for good reason, they work by inhibiting an enzyme in the liver
An enzyme in the liver.
called HMG-CoA reductase.
Okay, I'm not going to try and pronounce that.
No, that's right. It plays a key role in cholesterol production. So basically, statins put the brakes on cholesterol production at the source.
So it's like cutting off the supply chain.
Exactly.
Love it. Now, you mentioned something about statins being dose-dependent in our prep notes. What does that mean exactly?
So dose dependence simply means that the higher the dose of the statin, the greater the cholesterol lowering effect.
Okay, so it's like a sliding scale.
Exactly. It allows doctors to tailor the treatment to each individual's needs and target specific cholesterol levels.
Makes sense. Now, I gotta admit, I've also heard some not so great things about statins.
Oh.
Particularly about potential muscle problems. How serious is that?
You're right to bring that up. While rare, one potential adverse effect of statins is rhabdomyolysis,
Rhabdomyolysis.
a breakdown of muscle tissue that can be serious. So it's important to be aware of the signs and symptoms.
Okay, what should people be looking out for?
If you're taking statins and experience any unusual muscle soreness, weakness, or changes in your urine color,
Changes in your urine color.
contact your doctor immediately.
Noted, better safe than sorry.
Absolutely.
Any other quirks about statins that we should know about?
Just one practical tip.
Hmm?
Statins are usually taken in the evening
In the evening, why is that?
because cholesterol production in the liver peaks during the wee hours of the morning. So taking them at night allows the medication to be most effective.
Ah, so it's all about timing.
It is.
Got it. Now, there must be a ton of different statins out there.
You're right. There are quite a few atorvastatin sold under the brand name Lipitor, and simvastatin, known as Zocor,
Lipitor
are two of the most commonly prescribed statins.
Okay.
Both have a proven track record of lowering LDL cholesterol and reducing the risk of heart attacks and strokes.
Okay, so those are our statins in a nutshell.
Pretty much.
What about those bile acid sequestrants? They sound a bit more mysterious.
They do.
How do they work their magic?
They take a slightly less direct approach, but they're quite effective. They work by binding to bile acids in the intestine, preventing their reabsorption.
Okay, I think I'm going to need you to break that down a bit.
Okay.
It sounds a little roundabout.
It might seem that way, but it's actually a pretty clever strategy. Think of your liver as a recycling plant for cholesterol.
Okay, a recycling plant.
It takes cholesterol from the bloodstream and uses it to make bile acids, which help us digest fats. Bile acids sequestrants disrupt this recycling process, forcing the liver to pull more cholesterol out of the bloodstream.
Oh, I see. So it's like creating a shortage of bile acids, so the liver has to work harder and use up more cholesterol.
Exactly.
Okay, that's pretty cool. Our notes mention something about them coming in powder form.
Yes, some bile acid sequestrants come in powder form and need to be mixed with water or juice before taking them.
So it's like a little cholesterol cocktail?
You could say that.
Do we need a tiny umbrella for that?
Maybe not. But it's important to mix them well and drink plenty of fluids along with increasing your fiber intake to prevent constipation, which can be a common side effect.
Good to know. So good mixing and plenty of fluids are key. Anything else with the way these medications are taken that we should know about?
Yes, timing is important with bile acid sequestrants. They should be taken either an hour before or 4 to 6 hours after other medications or meals.
That's pretty specific. Why is that?
Because bile acid sequestrants can bind to other drugs and nutrients in the digestive tract, reducing their absorption.
Oh, so they could like mess with other medications.
Yes, exactly. So by separating them, we ensure that both the bile acid sequestrant and any other medications you're taking work as intended.
Makes sense. Any other important considerations with bile acid sequestrants?
Just one more thing. High doses of bile acid sequestrants can sometimes interfere with the absorption of fat-soluble vitamins, like A, D, E, and K.
Okay,
So your doctor might recommend supplements to prevent any deficiencies.
gotcha. Okay, on to our last type of antilipemic medication, fibrates. What makes them stand out?
Fibrates are particularly good at lowering triglyceride levels, and they can also give a boost to HDL, that good cholesterol we talked about earlier.
Oh, okay, so they're kind of like the multitaskers.
Yeah, they work through a few different mechanisms,
Okay.
including activating an enzyme that breaks down triglycerides, preventing the release of fatty acids from fat tissue, and increasing the secretion of cholesterol in the bile.
Wow, so they're like coming at those triglycerides from multiple angles.
They are.
Love it.
Yeah.
Are there any specific examples of fibrates that people might recognize?
Gemfibrocil and fenofibrate are two common ones.
Okay, got it. Anything else we should be aware of regarding fibrates?
Just one important caution: when fibrates are used in combination with statins, there's an increased risk of those muscle problems we talked about earlier, myopathy and rhabdomyolysis. So if you're prescribed both types of medications, your doctor will monitor you closely.
Noted, it seems like there are always things to consider when it comes to medications, but knowing the potential risks and benefits is key.
Absolutely.
Before we move on to angina medications, are there any other antilipemic treatments out there?
Actually, there is. We should briefly mention a newer class of medications called PCSK9 inhibitors.
PCSK9 inhibitors.
They're a bit more specialized and are typically reserved for people who don't respond well to statins or have a genetic predisposition to very high cholesterol.
So these are like the big guns?
You could say that.
Yeah.
These medications are administered by injection and can significantly lower LDL cholesterol levels.
All right, so they're like the heavy hitters of the cholesterol lowering world.
Exactly.
Yeah.
But they're not for everyone. Your doctor will determine if PCSK9 inhibitors are the right option for you.
Got it. So we've covered the basics of high cholesterol and the different types of medications used to manage it. Now let's shift gears and talk about angina, shall we?
Sounds good.
We'll dive into that right after.
Wait, before we move on, let me quickly recap what we've discussed about antilipemics.
Okay.
It's important to remember that high cholesterol, if left unmanaged, can lead to serious health issues,
Right.
like heart attacks and strokes. But the good news is that we have several effective medications along with lifestyle changes to combat high cholesterol and keep your heart happy. We covered statins, bile acid sequestrants, fibrates, and even touched upon the newer PCSK9 inhibitors.
Yes.
Each of these medications has its own mechanism of action benefits and potential risks.
Absolutely. And remember, folks, medication should always be taken under the guidance of a healthcare professional.
Very important.
Now, are you ready to explore the world of angina?
Let's dive in.
All right, so angina. Angina, not exactly a word that evokes happy thoughts.
No, not really.
Sounds kind of scary, to be honest.
It can be, but the more we understand about angina, the better equipped we are to manage it and keep those scary feelings at bay.
That's true. Knowledge is power.
Exactly. So
Yeah.
essentially, angina is chest pain that happens when the heart muscle isn't getting enough oxygen-rich blood.
So, like a supply chain issue for the heart.
Exactly. Imagine your coronary arteries as a network of highways delivering vital supplies to the heart muscle.
Okay.
Angina occurs when those highways get clogged, restricting blood flow and causing that chest pain.
Gotcha. And what causes those blockages in the first place?
Well, the usual suspect is atherosclerosis, that buildup of plaque we talked about earlier in relation to high cholesterol.
Right.
As plaque accumulates in the artery walls, it narrows the passageway, making it harder for blood to get through.
So it's all connected. High cholesterol can lead to plaque buildup, which can then lead to angina.
You get it. It's like a domino effect.
Wow. Okay, and what about the heart's demand for oxygen? Does that play a role in angina as well?
Absolutely. Myocardial oxygen demand, or how much oxygen the heart needs to function properly, is influenced by several factors.
Okay.
Primarily heart rate and contractility, which is how strongly the heart muscle contracts.
Okay, so if your heart is beating faster or pumping harder, it needs more oxygen.
Precisely.
Okay, pretty straightforward. What are some things that can increase heart rate and contractility?
Well, think about things that get your adrenaline going.
Like public speaking.
Exactly. Caffeine, exercise, stress. These can all trigger your sympathetic nervous system, that fight or flight response.
Right.
And when that happens, both your heart rate and contractility increase.
Ah, so that explains why I sometimes feel a little tightness in my chest after one too many cups of coffee.
It's possible now not all angina is created equal.
Oh, really?
There are different types, each with its own characteristics and triggers.
Okay, let's break those down. What are the main types of angina?
The three main types are stable angina, Prinzmetal's angina, and unstable angina.
Okay.
Stable angina is the most common, and it's characterized by predictable chest pain that usually occurs with exertion and is relieved with rest or medication.
So it's like your heart has a certain threshold for exertion, and once you cross it, angina sets in.
Exactly. Prinzmetal's angina, on the other hand, is caused by a spasm of the coronary arteries rather than plaque buildup.
Oh, okay.
The pain can happen at rest and often occurs at night.
That sounds a lot less predictable.
Yes, it is.
And more frightening.
It can be.
What about unstable angina?
Unstable angina is the most concerning type. It's characterized by chest pain that comes on even at rest, is more severe, lasts longer, and doesn't follow a predictable pattern. It's basically a warning sign that a heart attack could be imminent.
Yikes. So if you experience unstable angina, it's time to call 911 immediately, right?
Absolutely, unstable angina is a medical emergency.
Okay, good to know. Now let's talk about how medications can help manage angina. What's the general approach?
So the main goals of drug therapy for angina are to increase oxygenated blood flow to the heart muscle or decrease the heart's demand for oxygen.
So we're either trying to improve the supply or reduce the demand.
Exactly.
Makes sense. So what kind of medications do we have in our arsenal to fight angina?
We've got a few heavy hitters. Nitrates, beta blockers, and calcium channel blockers are the mainstays of angina treatment.
Okay.
Each works in a slightly different way, but all aim to improve blood flow to the heart.
Our notes say that nitrates are often the first-line therapy for angina. Why is that?
Nitrates like nitroglycerin are incredibly effective at quickly relieving angina pain. They work by relaxing smooth muscles in the blood vessels, causing them to dilate or widen.
Okay.
This dilation reduces preload, which is the amount of blood returning to the heart, and afterload, which is the resistance the heart has to pump against.
Gotcha.
Both of these actions ease the workload on the heart, reducing its demand for oxygen.
So nitrates are like opening up those clogged highways in the heart, easing the traffic jam and allowing blood to flow more freely. I like it. What are the different forms of nitrates available?
Nitrates come in a variety of forms to meet different needs. We have rapid-acting forms like sublingual tablets or sprays, which are used to treat acute angina attacks.
Okay.
And then we have long-acting forms such as transdermal patches, which are used to prevent angina episodes.
Okay, so rapid acting for when it's happening.
Yeah.
And long acting to prevent it from happening.
Exactly.
And what about nitroglycerin? It seems like the superstar of the nitrate world.
It is. Nitroglycerin is the most widely used nitrate and comes in several forms.
Oh.
Oral tablets, sublingual tablets, intravenous solutions, ointments, transdermal patches, and sublingual sprays.
Wow, that's a lot of options. Is there a difference in how these forms work?
Yes, there is some forms of nitroglycerin, like sublingual tablets and sprays, bypass the liver and avoid what's called the first pass effect.
Hold on, first pass effect. You've lost me. Can you explain that in a way that makes sense for someone who isn't a pharmacology expert?
Of course, the first pass effect refers to the way some medications are metabolized by the liver before they reach the bloodstream.
Okay.
When a medication is swallowed, it first travels through the liver, where enzymes can break down a significant portion of the drug, reducing its effectiveness.
Mm-hmm.
Some forms of nitroglycerin, like those sublingual tablets and sprays you put under your tongue, are absorbed directly into the bloodstream, bypassing the liver, and therefore the first pass effect, this allows them to act much more quickly.
Ah, so it's like a shortcut.
Exactly.
Makes sense. Are there any situations where nitrates shouldn't be used?
Yes, there are a few contraindications for nitrates, which means situations where they could be harmful.
Okay, like what?
These include allergies to nitrates, severe anemia, low blood volume, low blood pressure, closed-angle glaucoma, severe liver impairment, early stages of a heart attack, a heart condition called hypertrophic cardiomyopathy, severe head injury, increased pressure in the skull, and very importantly, if someone is taking erectile dysfunction medications like Viagra or Cialis.
Whoa, that interaction with erectile dysfunction medications sounds serious. What's the deal with that?
Combining nitrates with erectile dysfunction medications can cause a dangerous drop in blood pressure. Both types of medications work by relaxing smooth muscles and blood vessels, and using them together can lead to dizziness, fainting, and even more serious complications.
Got it. So if you're taking nitrates, maybe skip that little blue pill or at least talk to your doctor first. Are there any other potential downsides to using nitrates?
One thing to be aware of is that tolerance can develop with nitrates.
Tolerance meaning?
This means that over time you might need higher doses to achieve the same effect.
Ah, our body's always adapting. Is there any way to prevent or minimize that tolerance from developing?
Yes. Doctors often recommend scheduling nitrate-free periods to give the body a break and allow those enzyme pathways involved in nitrate metabolism to reset.
Oh, okay.
For example, someone using a nitroglycerin patch might be instructed to remove it overnight.
Okay, that makes sense. So let's say someone is experiencing an acute angina attack. What should they do?
First, stop any activity and sit or lie down. Then take a sublingual nitroglycerin tablet or use a spray and wait 5 minutes if the pain doesn't subside. Take a second dose and call 911 if there's still no relief after another 5 minutes. Take a third dose while waiting for emergency medical services to arrive.
Got it. So it's 3 doses, 5 minutes apart. And if there's no relief call for help, what about those intravenous infusions of nitroglycerin? When are those used?
Intravenous nitroglycerin is typically used in a hospital setting for more severe cases of angina or other cardiac conditions.
Mm-hmm.
Patients receiving IV nitroglycerin require continuous monitoring of their heart rhythm and blood pressure to ensure safety. It's not something you do at home.
Right. Okay. So we've covered the basics of nitrates, how they work, the different forms, potential side effects, and contraindications. Anything else our listeners should keep in mind about using these medications safely and effectively?
Just a few practical tips. First, always keep your nitroglycerin medication on hand and store it properly away from moisture, light, and heat. Keep it in its original packaging to ensure it stays potent. And remember, a burning sensation felt with a fresh supply of sublingual nitroglycerin indicates that the drug is still active.
Okay.
Second, dispose of expired medication properly. Third, if you're using the spray form, prime the pump if it's a new bottle or hasn't been right.
We talked about the statins, which work by actually inhibiting cholesterol production in the liver.
Uh-huh.
Then we moved on to those bile acid sequestrants, which bind to bile acids in the intestines, forcing the liver to use up more cholesterol to make new bile acids.
Right, like in a little roundabout way.
Exactly. And of course, we can't forget about those fibrates, which are particularly good at lowering triglyceride levels and boosting HDL cholesterol.
Right, the good cholesterol.
Yes. And then we even touched on those newer, more specialized medications like PCSK9 inhibitors.
Uh-huh.
It's amazing how many options are out there.
It really is.
But you know, one thing that really stuck with me is that while these medications are super valuable tools,
Yes.
they're not a magic bullet.
Yeah.
They work best when combined with lifestyle changes.
Absolutely. A healthy diet, regular exercise, all of that good stuff.
Right. It's about taking care of ourselves from the inside out.
Exactly.
And speaking of taking care of ourselves, we then moved on to angina.
Uh-huh. That chest pain that can really
Yeah.
put a damper on things.
Yeah, for sure. We talked about the different types of angina from stable to unstable.
Right.
And how important it is to recognize the warning signs and know when to seek medical help.
Absolutely. Chest pain is not something to mess around with.
No, it's not. And it all comes down to that balance between oxygen supply and demand in the heart.
Right.
How things like stress, caffeine, even exercise can sometimes trigger those angina episodes.
Exactly. And remember, those 3 main types of medications we talked about for managing angina.
Yes.
Nitrates like nitroglycerin beta blockers and calcium channel blockers.
Yes. Each class works in its own unique way,
Mm-hmm.
but all aim to either increase blood flow to the heart or reduce the heart's demand for oxygen.
Precisely.
And it's so important to take these medications as prescribed and be aware of any potential side effects or interactions.
Absolutely. Medications are powerful tools, but it's crucial to use them responsibly and always under the guidance of a healthcare professional.
So true. Well, I think we've done a pretty thorough job of exploring these cardiovascular medications today.
I think so too.
From those cholesterol-lowering agents to those angina-taming powerhouses.
We covered a lot of ground.
We did. It's amazing how far we've come in treating and managing heart conditions.
It really is. But you know what I'm even more excited about is what the future holds for cardiovascular medicine.
Oh, yeah. What's next on the horizon?
Well, think about gene therapy, personalized medicine tailored to our unique genetic makeup, even artificial intelligence, helping us diagnose and treat heart conditions more effectively.
Wow, that's incredible.
The field is constantly evolving, and there are some truly groundbreaking discoveries just around the corner.
It's a pretty exciting time to be alive.
It is.
Well, that about wraps up our deep dive into cardiovascular medications. Thank you so much for joining us.
It's been a pleasure.
And remember, folks, knowledge is power when it comes to your health. Stay informed, ask questions, and be proactive about your heart health. Until next time, stay curious and keep diving deep.